lecture, we're going to be talking about shock. Shock describes the state of collapse and failure of the cardiovascular system. In the early stages, the body attempts to maintain homeostasis. As shock progresses, blood circulation slows down, eventually ceases. EMTs respond to different types of emergency to provide care and transportation. They must be constantly alert to the signs and symptoms of a shock. Perfusion is the circulation of an adequate amount of blood to meet the cells' current need. The body is perfused via the circulatory system. Organs, tissue, and cells must have adequate oxygenation or they may die. In cases of poor perfusion or shock, transportation of carbon dioxide out of the tissue is impaired, results in a dangerous buildup of waste products, which may cause cellular damage. Cardiovascular system consists of three parts. The first part is the pump, which is the heart. The second part is set of pipes, which is blood vessels or arteries. And then is the content, which is the blood. Take a look at this diagram and it will show you how it works. Blood pumps all the way from the heart through the vessels or the arteries and it goes to the organs. That's how it works. These three parts can be referred to as the perfusion triangle. When a patient is in shock, one or more of the three parts is not working properly. Blood pressure is the pressure of blood within the vessels at any moment in time. We got the systolic, which is the peak arterial pressure. The diastolic pressure in the arteries while the heart rests between heartbeat. So the systolic is the peak arterial pressure. The diastolic is the pressure in the arteries while the heart rests between heartbeats. Pulse pressure is the difference between systolic and diastolic pressure. Pulse pressure signifies the amount of force to the heart generated with contraction. A pulse pressure less than 25 may be seen in a patient with shock. Okay, blood flow through the capillary beds, which is regulated by the capillary sphincters, under the control of the autonomic nervous system. The capillary sphincter respond to other stimuli too, heat, cold, and the need for oxygen and waste removal. Perfusion requires more than just having a working cardiovascular system. It needs adequate oxygen exchange in the lungs, adequate nutrients in the form of glucose in the blood, and adequate waste removal primarily through the lungs. Mechanisms are in place to help support the respiratory and the cardiovascular system when the need for perfusion or vital organ is increased. Mechanisms include the autonomic nervous system and hormones. Hormones are triggered when the body senses pressure failing, causes an increase in heart rate, strength of cardiac contraction, and peripheral vasoconstrictions. Together, these actions are designed to maintain pressure in the system, sustain perfusion of all vital organs. It is this response that causes all the signs and symptoms of shock. What are the causes of shock? Shock can result from bleeding, from respiratory failure, acute allergic reaction, and overwhelming infection. Damage occurs because of insufficient perfusion of organs and tissues. Take a look what happened when the pump failure happened. The pump when the heart is not pumping right, let's say, okay, you could get a heart attack. Okay, you could get um, an obstructive causes, which is going to cause like pulmonary embolism. Low fluid volume causes trauma to vessels or tissue. Poor vessels function causes infection, drug overdose, like narcotic, spinal cord injury. Okay, when we got a pump failure, okay, this will cause a cardiogenic shock or obstructive shock. When we're talking about poor vessels function, it is a disruptive shock. When we talk about low fluid volume, we're talking about the hypovolemic shock. Okay, let's talk about cardiogenic shock. It is caused by inadequate function of the heart, which is a major effect. It's going to be the backup of the blood into the lungs, which is going to result in a buildup of pulmonary fluid, which is we call it pulmonary edema. In a cardiogenic shock, edema is the presence of abnormal large amount of fluid between cells in the body tissue causing swelling. You could see a lot of it down in the feet. Pulmonary edema leads to impaired respiration, which may manifest by an increased respiratory rate or abnormal lung sound. So this is how you're going to tell, okay? His respiration, his respiratory rate is going to be higher than normal. And when you listen with your stethoscope, you're going to hear sounds in his lungs. Cardiogenic shock will develop when the heart cannot maintain sufficient output to meet the demands of the body. That means the heart is not pumping right. Okay, now let's talk about obstructive shock. It is caused by a mechanical obstruction that prevents an adequate volume of blood from filling the heart chambers. Three of the most common examples is cardiac tamponade, tension pneumothorax, and pulmonary embolism. The cardiac tamponade is a collection of fluid between the precordial sac and the myocardium, which becomes large enough to prevent ventricular from filling with the blood. Caused by what causes it could be a trauma or a penetration. The signs and symptoms are referred to as Beck triad. The tension pneumothorax is caused by damage to lung tissue. The air normally held within lung escapes into the chest cavity. The lung collapses and air applies pressure to the organs, including the heart and great vessels. The pulmonary embolism, a blood clot that blocks the flow of the blood through the pulmonary vessels. If massive, It can result in a complete backup of blood in the right ventricle, leads to catastrophic obstructive shock and a complete pump failure. Now let's talk about the disruptive shock. It results from a widespread dilation of small arterial or small venules of both. The circulating blood volume pulls in the expanded vascular beds, tissue perfusion decreases. Septic shock occurs as a result of a severe infection in which toxins are generated by bacteria or by infected body tissues. Toxin damages vessels walls, causing increased cellular vessels will leak and are unable to contact well. Widespread dilation of vessels in the combination with plasma loss through the vessel wall results in shock. Neurogenic shock, usually the results of a high spinal cord injury. The causes include brain condition, tumors, pressure on the spinal cord, or spina bifida. Muscles in the blood vessels wall are cut off from the nerve impulse that causes them to contact. Let's talk about anaphylactic shock. Occurs when a person reacts violent to a substance to which he or she has been sensitized. Sensitization means becoming sensitive to a substance that did not initially cause a reaction. Each subsequent exposure tends to produce a more severe reaction. Four categories of exposures to the anaphylactic shock is injection, like tetanus antitoxins or penicillins, stings, wasp, bees, hornets, ingestions, fish, shellfish, nuts, eggs, medication, inhalation, dust, pollen, and mold. The anaphylactic shock develops within minutes or even seconds of contact with substance. Second phase reaction can occur 1 to 8 hours after the initial reaction. Signs are very distinct. Cyanosis, blue discoloration of the skin, is a late sign. Psychogenic shock. It is caused by a sudden reaction of the nervous system that produces temporary generalized vascular dilation, results in fainting, which we call sometimes syncope. Some causes are serious and others are not. With syncope, it has to go to the hospital all the time. A lot of times we see people say it's a syncope. Syncope has a reason for it, so a person needs to be transferred. Life-threatening causes include irregular heartbeat and brain aneurysm. Non-life-threatening events include receipt of bad news of experience, fear, or unpleasant sights such as blood. Let's talk about a hypovolemic shock. It results of an inadequate amount of fluid or volume in the circulatory system. Hemorrhagic causes and non-hemorrhagic causes occurs with severe thermal burn. Intravascular plasma is lost. Dehydration, the loss of water or fluid from body tissue, can cause or aggravate shock. Fluid loss may be a result of severe vomiting and or diarrhea. Respiratory insufficiency. A patient with a severe chest injury may be unable to breathe in an adequate amount of oxygen. An insufficient concentration of oxygen in the blood can produce a life-threatening situation as rapidly as vascular causes of shock. That's why a lot of time also it's very important to take the to use the pulse ox and see if the oxygenation in the blood. Anemia is an abnormal low number of red blood cells. Hypoxia occurs because blood is unable to deliver adequate amounts of oxygen to the tissues. Certain types of poisoning may affect the ability of cells to metabolize or carry oxygen. Carbon monoxide poisoning, cyanide poisoning. Those always happen if we go to a fire scene like we've seen in the drill, you're going to have to expect carbon monoxide poisoning and cyanide poisoning, which is hydrogen cyanide. The progression of a shock. The stages and progression of a shock is compensated shock, early stage when the body can still compensate for blood loss. Decompensated shock, late stage when blood pressure is failing. No way to assess when effects are irreversible. Must recognize and treat shock early. Blood pressure may be the last measurable factor to change in shock. When a drop in blood pressure is evident, shock is well developed. Particularly true in infants and children. Expect shock in many emergency medical situations. Also expect shock if a patient has any one of the following conditions: multiple severe fractures, abdominal or chest injury, spinal injury, a severe infection, a major heart attack, anaphylaxis. Okay, now let's talk. We arrive at a scene. First thing you gotta do is a scene size up. You have to be alert to potential hazards to your safety and to your crew. Definitely you have to do BSI, use gloves and eye protection for trauma scenes or if bleeding is suspected. An incident involving violence, make sure the police are on scene and the scene is safe. Your primary assessment. First of all, perform a rapid exam. Determine of the level of consciousness. Identify and manage life-threatening concerns. So if there's a lot of bleeding, that's the first thing you gotta do. Determine priority of the patient and transport. Provide high flow of oxygen to assist in perfusion. For hypoperfusion, treat aggressively and provide rapid transport. Request ALS as necessary. From a general impression, assess the airway to ensure it is patent. Assess the breathing. An increased respiratory rate is often an early sign of impending shock. Assess patient circulatory status. A rapid pulse suggests compensated shock. In a shock of compensated shock, the skin may be cool, clammy, or assess for and identify any life-threatening bleeding and treat it at once. Determine if a patient is high priority, if ALS is needed, and which facility to transport to. It's very important. Something like this, he has to go to a trauma center. Trauma patient with shock or a suspicious MI generally should go to a trauma center. Okay, now second one, we gotta get some history. Determine the chief complaint. Obtain a sample history. Once we're done with that, we gotta do our secondary assessment. You gotta begin by repeating the primary assessment followed by the focus assessment. If a life-threatening problem is found, treat it immediately. Obtain a complete set of baseline vital signs. Use monitoring devices. Reassess the patient's vital signs, interventions, whatever you have done, chief complaint, if they changes, ABCs, mental status. Determine what interventions are needed. Focus in supporting the cardiovascular system. Treat for shock early and aggressively by providing oxygen, keeping the patient warm. How you keep him warm? Use blankets, cover him, even if you have to use some heat pads. As soon as you recognize shock, begin treatment. Follow standard precaution, control all obvious bleeding, make sure the patient has an open airway, maintain manual inline stabilization if necessary, and check breathing and pulse regularly. Comfort, calm, and reassure the patient. Never allow patient to eat or drink anything prior to being evaluated by a physician. If spinal immobilization is indicated, splint the patient on a backboard. Provide oxygen and monitor patient's breathing. Place blankets under and over the patient. Consider the need of ALS. Do not give the patient anything by mouth, no matter how urgently you are asked. Accurately record the patient vital sign approximately every 5 minutes throughout the treatment and transport. That's very important. Okay, you want to see the increase or the decrease of things. Okay, in case of shock, you're going to notice that his pulse will stop being rapid and his breathing is going to be going faster and stuff like that. Patient cannot generate the power to pump blood throughout the circulatory system. That's in a cardiogenic shock. Chronic lung disease will aggravate cardiogenic shock. Patient is cardiogenic shock should not receive nitroglycerin. They are hypotensive. Patient usually have low blood pressure, weak irregular pulse, sinuses about lips underneath fingernails, anxiety, nausea. Place the patient in a position that eases breathing as you give high flow oxygen. Assist ventilation as necessary. Provide prompt transportation. Consider meeting ALS en route to hospital if they were not on scene. Provide calm reassurance to a patient with a suspected heart attack. For, for cardiac tamponade, increasing cardiac output is the priority. Apply high flow oxygen. Surgery is the only definite treatment for this person. Precardiocentesis uses a needle to withdraw blood. Advanced skill rarely performed in the field. For tension pneumothorax, apply high flow oxygen to prevent hypoxia. Chest decompression is required. Ask for ALS early in call if available, but do not delay transport. They could intercept on the way if they're not there right away. Transport is very important. How are we going to treat septic shock? Hospital management is required. Use standard precaution in transport. Administer high flow oxygen. Ventilate support may be necessary. Use blanket to conserve body heat. Use sepsis team if available. Treating a neurogenic shock. For the spinal cord injury patient, use a combination of all known supportive measures. Hospitalization will be required for a long time. Emergency treatment: obtain and maintain a proper airway, provide spinal immobilization, assist in adequate breathing, conserve body heat, ensure the most effective circulation, transport promptly. How are we going to treat anaphylactic shock? Administer epinephrine, promptly transport the patient, provide high flow oxygen and ventilatory assistance en route. A mild reaction may worsen suddenly. Consider requesting ALS backup if available. In an uncomplicated case of fainting, once the patient collapses, circulation to the brain is restored. Psychogenic shock can worsen other types of shock. If the patient falls, check for injuries. If the patient reports being unable to walk after a fall, suspect another problem, transport the patient promptly, record all initial observation, and try to learn from bystander. If the patient complained of anything, how long the patient was unconscious for. Hypovolemic shock: control all obvious external bleeding, keep the patient warm, recognize internal bleeding, and provide aggressive support. Secure and maintain an airway and provide respiratory support. Transport as rapidly as possible. Respiratory insufficiency: secure and maintain the airway, clear the mouth and throat of obstruction. If necessary, provide ventilation with a BVM. Administer supplemental oxygen. Transport the patient promptly. Treating shock in older patients: be careful. Okay, you have to be cautious when caring for older patients. Older patient has more serious complications than younger ones. Illness is not just a part of aging. Many older patients take medication that mask or mimic signs of shock. This is the end of our lecture for today. If you have any question, hold on to it. We'll be back in 5 minutes. Or if you think of a question later on, you could send me an email to cpr.tony cpr.sari@gmail.com. Thank you and have a pleasant day. Don't forget to visit our website, cprlearningcenters.com. We have more training on, and you could see it as it comes out. Thank you. Bye bye.